you had a little bit in the book about how you started and your relationship with your writing partner and how that kind of turned into what
Mhm.
became the book, and that goes all the way back to the late 60s or early 70s, correct?
Exactly.
Yeah.
That's absolutely
And
right.
and did you know you wanted to go into medicine in college at the time, or were there other factors that sort of led you that direction?
Right. It's really interesting. I grew up in the late 60s when there was a lot of turbulence. There was a lot of activism and social activism and women's
Yeah.
movements. And so we were really out there exploring and traveling and wanting to get a liberal arts education. So that was really the
Yeah.
focus. And so initially, what I did is I went to nursing school because that's what a woman
Huh.
would do at that age, right?
Right. Right.
And then quickly went on to be a nurse practitioner. And even during that time as a nurse practitioner, I was working in Duluth with a holistic practitioner in the early 1980s.
Oh,
So
wow.
yeah, so there was a lot of movement at that time, and we were doing just a lot of interesting work in Duluth, and which inspired me to say, I need to go to medical school because I really am interested in this holistic health, integrative medicine, or what we were calling at that time complementary alternative medicine, for a better
Right.
word for it.
Yeah.
So that really is what prompted me to go to medical school. Of course,
Ah.
um, as you matriculate through medical school and residency, you lose some of that passion because you just have to survive learning everything else. And
Yeah.
so it's once I got really out into practice and started listening to people's stories and
Yeah.
realizing that I didn't have a lot of answers. And many of my patients didn't want to do medicine. They didn't want to do
Mm-hmm.
surgery. They wanted to do other, they wanted other answers,
Yeah.
and
And practices too. I feel like that's the it seemed like that came up a lot in the book for your work, and it's been a big part of my work too. Is like but that requires time and education too.
well, it was at that time, I was doing, you know, broad spectrum family medicine, and I just said, no, I have to go back and get more educated for my patients. So I took a botanical medicine, a very extensive course, started functional medicine when it was at its infancy.
Yeah.
Infancy, was always interested in nutrition and the digestive system, so that was an easy fit for me, and just there was just a lot of movement. As you well know, it was during that late 80s when Bill Manahan started the Minnesota Holistic Medicine Group, and I have
Yep.
been a co chair with him for the last number of years. And that was a way to get like minded people together, to get them passionate, excited, and networking. And like you said with
Yeah.
Stacy Deegan, referring people
Yeah.
to
Yeah.
people you trust.
That's it's so cool that you guys had the whatever the motivation to start doing that at that time, because it must have been hard to sort of, I mean, even now the term holistic is still carries with it so many negative connotations, as if it's not a real way of thinking about health and well-being.
Isn't that unfortunate? It's such a good name. It's such a
I
good
know.
definition.
Yeah.
It's really that holistic health is how we care for ourselves, our whole person, body, mind, and spirit. Yet it's
Yeah.
got this history of being associated with, I think, with the late 60s and early 70s. I always said the two H's, hippies and holistic, were together. And
Right.
a lot of the older physicians just could not separate the two out.
Right.
It
Yeah.
was all,
And and I know you traveled quite a bit in your younger years. Went to Mexico, just worked in Guatemala for a year,
that's
went over
right.
to India to do some studying, and actually you and I have one kind of other crossover, which is that you spent some time at Turtle Mountain in North
Oh,
Dakota on the reservation. I went there for a study week when I was in college and got to work with people there, and it was a kind of an exchange, and it was an amazing experience. Got to do a sweat and spend
oh
all
my
this time with them
goodness.
talking and stuff. Yeah, it was really amazing.
Oh, that is interesting. And where was that with? Was that with the University of Minnesota,
I
North
No,
Dakota?
I went to school at St. John's University, and they just had this. Someone just set it up for like a spring break program, and I just I had always been interested, and I'm sure this was before I ever had any thoughts of getting involved in medicine. But I imagined because of that experience that the way that it sort of changed me in thinking about practices, that all of your traveling probably informed how you were going to work. And was there anything in particular that you picked up from any of those experiences?
Oh, I just think, with travel and especially like being in Guatemala for a year and really just seeing a different way that people heal.
Yeah,
And the health system is, we don't have the conventional medicine didn't exist down there, so it was limited. But looking at just the whole breadth of cultural medicine and traditional
right.
medicine was eye opening. It
Yeah,
really was. And when we travel, that's what we really want to. We want to learn. We want to see. We want to
yeah,
be exposed. We're curious. We want to see how other way things are done. And of course, my experience was later on, but to go to um, to India and to be at a Tibetan medicine college or school
mm,
and see how the kind of medicine that they make, um, how they use the three constitutions or the three doshas like an Ayurvedic medicine, how they
yeah,
don't frame people as all the same, that you are a combination of so many different kinds of energies and elements. I just find that fascinating.
yeah. Yeah, me too. And I happened to learn a bit of that when I was in massage school, and I still use a lot of the sort of basics of that. And I've actually connected with the doctor who was at our conference where we reconnected again.
Oh, okay.
She's gonna come on the podcast as well soon, so we'll get into that a little bit more. But yeah, there's something about thinking about what balance looks like for people that
Mhm.
we never really touch on
We don't.
in
Yes.
traditional medicine.
And that's what I think is so, and because a lot of my emphasis has been on this aging woman and this postmenopausal woman. And what I really try to encourage women is not only advocacy, but that intuition, that knowing that they have.
Right.
Sometimes you don't even need to travel and to be exposed to something different. Sometimes you just intuitively know
Yeah.
where you need to go for healing. And
Yeah.
I think it's so important to reinforce that in individuals.
Yeah. Agreed. And and that I always lead my patients, clients into thinking about into trusting their instincts on something. And I'll even ask sometimes, before a session, because I sort of practice a lot of different modalities. I'll start there with like, what do you feel like you need the most today, and kind of check in with how, what's happening in your body today. How does your nervous system feel? What's happening with your gut? That kind of stuff. It almost always informs how I'm going to work with them, in a session.
Well, even you asking those questions, that you're asking people to connect to their body, something that we
Yeah.
don't often do. So you're,
Yeah.
you're helping them go, oh, I never thought about how my gut worked or how my gut felt. I never felt about
Yeah.
how my brain felt. So
Right.
you're initiating that mind body connection, which is just wonderful.
And it's the beginning of empowering them too. It's
Yes.
I never wanted to be the guru that knew everything. I never felt that way.
Mhm.
I tend to sort of shy away from this whole idea of being the healer.
Mhm.
It kind of rubs me wrong.
Yeah.
And also because of the innate part of this is that and you write about it in the book, is that we have this sort of an innate healing, regenerative system that is,
Exactly.
that's where the magic is. And I'm
That's
trying to
the
kind of help
magic.
them connect into that. So,
Yes. I think, one of the reasons I wrote the book, Beyond Menopause, was because I just felt that we do have that innate ability, but so many women get stuck and they don't know how to get there. They don't know how to begin
right.
the process. And and that's why, I divided that book into three different parts, and that first part is about advocacy, because many women who are now postmenopausal women are baby boomers, and we grew up in a very patriarchal health system. We
Yeah.
were told what to do, we weren't listened to, and our voice was silenced. Now
Yeah.
we're asking 70, 80, and 90-year-old women to, heal themselves, be their best healer. And they kind of look
Yeah.
at you and go, what? I don't know where to start.
Yeah. Well, this generation of women also were sort of gaslit into believing that when they had a problem, or it was just the way that they were sort of talked to and looked at, that you must be crazy, or this is all in your head.
Exactly. Yes. You asked me the question. You had posed a question on an email. You said, what did you say? How did you survive in the conventional setting?
Yeah, and what challenges were there? What did you run up against?
Yeah.
And also, how did you tackle that?
How did you tackle it? Well, it makes me think of what you just mentioned, is that, I was I worked in a conventional setting my whole life, and I always felt that I was filling in the gaps where no one else wanted to go. And so those people who came in with, or I had a lot of referrals with women who had chronic illnesses, or were told that it was all in their head, and yet they were suffering. They were suffering with fibromyalgia, chronic fatigue, a lot of other symptoms, and they didn't know where to go. So I was able to, and integrative and holistic health works well with these individuals, because they often don't react well to medication.
Right.
And so I was kind of a filler of gaps, a bridging of gaps in the conventional medicine setting.
Yeah, I feel the same, the way that I start with people a lot of times is I try to get a sense of sort of where they're at in this, mental, emotional, social realm, because if I get somebody in who's, also suffering from loneliness, also, has a history of some kind of, abuse of some sort, or trauma, some big trauma, I know that I have to also help them regulate their nervous system to start out with, because even if they do end up, and sometimes they're already on medication, but even if they do decide that that's something they want to pursue, I think it works better when their nervous system is also working better. And then all the other basics of the sort of pillars that you talk about in the book, they sleep better, they digest better, all the kind of basics that need to go on for someone to start to feel well need to be there. So that's kind of my starting point with a lot of things.
Yeah, I think, like you mentioned, the 5 pillars of health are, and sometimes those pillars look different to people, but I always use the restorative health. How are you reducing your stress? What are you choosing to do to be present? And because that's going to inform your sleep. Is your digestive system working? Are you putting good, nutritious food into your body? Are you moving your body? And I think the other thing for aging individuals, both men and women, is that it depends on what your attitude is. There's been a lot of bad press about aging, and yet it's something we're all doing, and we want to do it well.
Right.
And so, and we know that those who have a better attitude and are connected with community live longer and more productive lives.
Yeah. And so how did you work with people in a traditional setting then to try to bring into an integrative approach to healing? And I'm sure you worked with lots of different kinds of things, but with women's health issues where, I think for a long time it's getting better, but like the technology wasn't even being developed. The testing wasn't very good for any of it. So was that something you were able to bring into your practice, or convince people that these kinds of things needed to happen for your patients, or how did that work?
Yeah, I think when I think of how I approached a woman who would come into my office with any particular kind of condition was kind of what you said. I just listened to them and let them bring forth to me what they thought was most important. And usually, if you listen, you will hear what they need.
Absolutely. Yeah.
And then
Yeah.
you, like you said, you gently or, you try to bring in ideas that you hope will resonate with them. Things initiate ideas that outside of the conventional model that will feel safe for them. I know
Yeah.
I worked in the breast center and I was for a number of years at the university. And I was the kind of go between. If you didn't have, or if you had breast cancer, they would send them to me for integrative health. And one of the
Okay.
greatest fears on women's were if I decide to see a naturopath, for example, to talk about maybe botanicals or herbs or supplements, will my oncologist
Yeah.
not follow with me? And isn't
Right.
that an interesting fear to think that you cannot expand into a different health system without losing your primary care or your specialist?
Right.
And so one of my goals was to really make them normalize that for them, let them know that this was safe territory to move into, that it was essential for them to go there.
Yeah. And there's I feel like there's another part of this that is really sort of tapping into you need to be able to connect with what you think this person's belief system is.
Exactly.
And there are times where you just can't get them to go to where you want to go with any
Yeah.
of the holistic modalities, but sometimes you just have to find the low-hanging fruit or one thing that you're like, you know
Right.
sleep hygiene or something that that you could that is important to them that they want to improve.
Yeah, I'll never forget. I was at pickleball the other day, and a woman came up to me and she said, "Oh, doctor, are you Dr. Torkelson? I saw you 30, 40 years ago, and
Oh
I
my God.
want to tell you how you changed my life." And I said, "Oh, this is interesting. What did I do?" And she said, "You told me to use echinacea when I had an flu as an immune support." And she said,
Yeah.
"Why, that was the most valuable piece of information." Well, it was just my luck that I happened to 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 get on her wavelength at that time, 30 or 40 years
Right.
ago.
Right.
So
And that's the thing. We can only we don't know which things are going to stick either.
we don't know
And some
what's
people who like my practice is so different than being in a traditional clinic setting because people usually come to me with something that's either acute or chronic, I guess. But my goal is always to bring down whatever symptom is going on, and that almost always kind of engages them in thinking about, okay, well, what else if we can handle something like this that I thought wasn't going to go away, so well with just this kind of manual therapy, then what else could we do? What and so I start to kind of get them to like almost do some goal setting or tell me what activities you haven't been doing that you would like to re-engage with, those kinds of things. I feel like that's the starting point of them starting to direct that. You just reminded me of something you wrote in the book. I made a note because you were talking about these sort of teams of people, and it's one of the questions
web
I
of
wanted to get
wellness.
into with you. The web of wellness, right?
Yeah.
And so one of the things I haven't thought about it this way ever before, but whenever I think about teams, I always kind of think about like you and the patient client in the center and a group of people sort of around the outside, right? And that's the way that we sort of think about teams. But for some reason, the web of wellness idea took me into this idea that the patient is actually part of the circle, and that each of those players grows in importance or diminishes depending on what changes go on, and over time the individual who's seeking the team starts to grow. Their role in everything starts to grow. That was just a new idea that I had reading
Oh,
through that.
I just think that is so important because when I've been thinking about this web of wellness, I've been trying to think of a model of how it
Yeah.
looks, and it's
Yeah.
so dynamic. And it's three-dimensional, and you're at different places in that model at different times
Right.
of your
Exactly.
healing, and people come in play differently. And you may be able to go out and enjoy nature at one point in your life, and then that intersects with something else, and trying to find a model of how to display that. But you really pointed out that you're not always in the middle. You're moving
Yeah.
in that universe of healing.
Yeah. Yeah. And it's the partnership part of it that you talked about in the book. And
Yes.
that's why I realized like you should really be on the outside of that circle as one of the team members rather than just this center where everyone's sort of like inputting to you. You suddenly become one of the players more,
Yeah.
and as time goes on, you actually become the most important player as you start to gather or heal from different modalities or need one practitioner more or less, and that changes over time. So that was just a thank you for that because it triggered me.
How do you model that? How do you model that for people? It was
So
really
my yeah, and my thought of looking at this is that if let's say everybody around the circle was also a circle, and their size would change depending on the role, right?
yes.
Or so that was the model that I had in my head.
Hmm. Yes, I think we tried to emphasize that it was dynamic, it was changeable given your conditions. Different, you would have priorities of one practitioner, or
Right.
let's call them practitioner, over another, but you
Yeah.
yourself are a part of that movement.
Yeah. So that, with different kinds of things that come up for postmenopausal women, what's your way of? I imagine you become the point person, to start. Like let's to talk about this web of wellness again. So
Yeah.
so at how do you start to bring people into that web, or connect your patients to that kind of thing?
Well, I think when I'm talking about it globally, I encourage people to have a primary care physician, because I
Okay.
think that's kind of that first, what do you call it, the first layer in
Yeah.
this
Yeah.
structure. Um, and a lot of times patients expect the primary care doctor to be on their same page. And that's one of the frustrating things. I'll say, well, I found a primary care doctor, and they just don't know anything about integrative health. And how am I
Yeah.
supposed to develop a therapeutic relationship with them when they don't know anything about integrative care? And I
Yeah.
just say to them, okay, hold on, take a breath. Use that person in the best way possible, and then
Right.
expand to an other individual, another health system that is going to speak better to your language. Or
Yeah.
find a cranial sacral practitioner who can
Yeah.
really help you calm down that nervous system. But to think that you're going to find it in the primary care provider
Yeah.
is is just you might. You might. I hope that I was that for many, many patients. But I'm not, like you said, I'm not the healer here.
Right.
I am a facilitator.
Right. Yeah. And that model with the starting as having a foundation, over time you sort of learn, or I tell my clients this a lot of times, is go gather information. Every one of these people has something to offer, and you
Hmm.
kind of have to figure out how you're going to use them. And I think in a healthcare system, you don't always feel like you feel more like you're getting used at certain times.
Yeah,
and,
that's okay. Yeah.
yeah, no, it's okay, and sometimes they do know more than and they're going to help direct a certain amount of that. But over time, the goal is that the more resource you collect with different people, and also sometimes just hearing it from different practitioners. When I hit a wall with somebody, sometimes I think, who might be another person we could bring in that might have another approach, or they might be able to hear this same thing that I'm saying in a different way and be able to hear it, so and I don't expect that I should be able to, take care of everything that's going on with the person either. So I try to collect my own little, network too.
I think sometimes what's frustrating for patients is that they go to their primary care and their primary care says, well, I don't know much about that, but I don't think it'll hurt you. And that's sometimes really demoralizing for people. They
Yeah.
really want them to, and sometimes I wish I know the primary cares and are so overwhelmed and so busy, and even the
Right.
specialists. But I wish they too. And that's one reason I wrote the book, was it wasn't just for the lay public. It was for a practitioner to read it and say, oh, I never thought I could maybe offer that to my patient. Oh, I
Yeah.
could look at it this way differently. But we in the healthcare profession have to be willing to to push our boundaries too.
Yeah. Who are kind of the network providers that you tend to refer to with a postmenopausal woman?
Who you mean locally? Who do I refer to?
I mean, not necessarily the kinds of practitioners that you tend to refer out to, or suggest, some gap in care or whatever.
Uh, um,
I know acupuncture is one of your in traditional Chinese medicine, right?
yeah, I think that I'm just thinking about um, how when I see a woman and she's saying, "But I don't know where to start. I don't know where to go," and there's this new concept coming on out there, and it's a clinic called Herself Health. It's in the Twin
Mm-hmm.
Cities. It's for women over 65. So they are just your primary care provider for women over 65. I think
Yeah, I think my mom just connected with them. Yeah.
yeah, this is an interesting concept because what we believe will happen, and I can't speak to what is happening, but what we want to have happen is we want people who have expertise in postmenopausal women. There's
Yeah.
55 million of us out there, and we're not going away.
Yeah.
And so we need services. Now, when I'm talking more specifically about menopause transition, and you need to be talking about hormone replacement therapy or other kinds of therapies that may be beneficial to you during this 5 to 10 year transition,
Yeah.
then I want you to see somebody who really focuses on women's health and is willing to talk hormone therapy. It is only fair that you have that discussion so you know the risks and benefits.
Yeah.
And, this was a subject that was shut down in 2002 when the Women's Health Initiative, halted their study and said estrogen is probably causing breast cancer. And
Right.
for the last 20 years, nobody has wanted to give women hormone therapy. Now the research is different. It's saying, oh, it really isn't that problematic. There's a small risk, but not enough of a risk not to have it as a viable discussion and therapeutic option.
Yeah.
So, yeah, I don't know where I went with that, but
Yeah,
understood.
but that's it's the hard part about when things when someone puts out something like that is that it's hard to change people's minds again. So now to over 20 years later, I'm still this is why I wanted to talk to you about this a little bit, is because I feel like that's one of the things that I'm hearing. I work with quite a few transitioning and postmenopausal women, and I feel like that's becoming one of those things that it just brings up all this fear, and yet they're struggling with so many different kinds of things, health wise, endocrine system things, and some physical health challenges too.
Yes, and what has happened, as I mentioned, is that during this 20 years of fear about hormone therapy, nobody was educated in menopause or on hormones. So there's
Mm,
this dearth of very few providers who are willing to offer that care. But this is slowly changing. The media, the education around NAMS, the North American Menopause Society, which is now just a menopause society, is really beginning to educate nurse practitioners and physicians on appropriate, safe use of hormone therapy. And I just say to women going in their late 40s and into their 50s as this transition starts, seek out somebody who is knowledgeable so that you don't live in fear about it, but you embrace it as a safe modality.
Yeah. And are there certain kinds of care that you wrote about this in the book, but I'm curious to know what your experience was, sort of how, and maybe how it's changed over the course of your career. I know you're recently retired, right?
Yeah.
but in the kinds of care that women were kind of coming to you for that they realized they weren't receiving, what were the kinds of things that you felt like they were asking for that they weren't getting access to?
Certainly. Let me just step back. So in my book, in the second part of the book, I have 8 different chapters. And the reason I chose those 8 different chapters was because they were common problems that women presented to me with that no one would talk to them about.
Right,
or
right.
they just didn't know what to say. They would just say, oh, well, I don't know what to do about that. And that was a menopause transition. It was about sexual health and sleep, anxiety, fatigue, weight changes, bone and brain health. So talk about gaps. There's huge gaps there. And yet there is a plethora of things that we can offer women that could be helpful during this time. So actually in my practice, I was at, women's health specialists and with a big group of OBGYN. But of course, their focus is on reproduction in the childbearing years. So who talks about those other years? The rest of the 50 years you have to live in your life.
Yeah.
And those women feel invisible. They feel neglected in the healthcare system.
Yeah.
So, I often even would spend time talking about hormone therapy to women, often encouraging a bioidentical product that you don't need to go to a compounding pharmacy to get. You can go to a compounding pharmacy to get it. And I think I go through that real carefully in the book because I want people to understand that they can get a safe, bioidentical progesterone and estrogen that is FDA approved from their primary care doctor, should they choose.
Yeah. And can you explain what bioidentical means?
Bioidentical simply means replacing, or it's a chemical that is synthetic, that is as close to your biological hormone as anything else. The reason, and the word bioidentical was not a term that was liked by conventional medicine. It has now become more accepted, but the vernacular came from an alternative medicine. And so it was kind of refuted initially and saying, why is it just about bioidenticals? Well, it's not to say that the estrogen products that we were using before are necessarily bad, because that's what the studies have done on. And when I refer to estrogens, I mean Premarin, which is pregnant mare's urine. That's where we get the estrogen from. Okay. Now that doesn't mean that that's a bad product, but my point was, why not give something that is closest to what our bodies have produced? So, giving a straight estradiol was something that was just easier for me to do. Yeah. And
are there times when it's that there can be a decision about whether to do just estrogen or some combination of estrogen progesterone, and what's the reasoning behind one or the other?
From a allopathic perspective or conventional medicine perspective, the reason we give progesterone, in addition, when we give estrogen, is to protect the uterus so that the uterus does not proliferate and potentially cause uterine cancer. So we give the progesterone as a way to avoid that. Now, if you have a hysterectomy, you don't necessarily have to take progesterone. Okay. However, there are many women, when they go through that menopause transition, that feel better on both estrogen and progesterone, even if they don't need the progesterone for the protection of their uterus. Does that make sense?
Yep, got it. That totally makes sense. And you talked in the book too about, kind of looking also at dietary factors, whether someone's on, estrogen or not, or hormone replacement or not. There are lots of different things. So can you kind of maybe do the short list version of the things that you, because it's a lot. The book's very dense, even though it's very short. There's a lot in there.
Yeah. And so, not everybody's needs is going to go on hormone replacement. They may say, I am fine with, there are studies on different herbal products that have not maybe proven statistical significance, but in my anecdotal experiential practice seem to help during perimenopause, things like black cohosh. Mm-hmm. Now, another product, which is an herb that has been used for centuries for that menopause transition, also used for a lot of other things. There is something now is becoming more something called maca that is used also for hot flashes. There are, I think, one of the most beneficial symptoms, like what we're trying during menopause transition, the reason women come asking for hormones is because their body feels unbalanced. All right. They just feel like they don't have any control of what their body's doing and they feel miserable. So
their brain gets affected, their mood gets affected.
So one thing that I'll always encourage is say, we want to look at rebalancing. So doing things like mindfulness, breath work, acupuncture work, stress reduction in any way that you find that valuable, good sleep. These are all, even though they exercise program, even, so you get out and you move your body, you generally feel better. So even
forest bathing.
Anything when you can reduce that HPA axis, because a lot of symptoms get triggered, especially hot flashes get triggered, because your thermoregulatory system is so marginal. So anything you can do to expand that thermoregular system and avoid getting that overwhelming hot flash and brain fog, these are the kinds of valuable interventions.
Do you know if anything like hot and cold therapies are beneficial for they're sort of almost kind of like an immune challenger, where they kind of they sort of throw it off and force your body to regulate? Does that have any? It works for athletes and things, but I don't know if it does it work for postmenopausal women or transitioning women?
I've never seen a study on that. My sense would be, if somebody asked me that question, I would say, tell me how you respond. Is that something, if you were going to a retreat, would you do hot and cold therapy? And if somebody said, never, somebody said, I love it. It's just the most soothing, comfortable thing. That's where I would go.
Right. Yeah.
So I would check it out. That's a good question. Yeah.
So as far as sexual health is concerned, how what are the big challenges that you face, and are there any things that you recommend as far as what goes on in our later years?
Absolutely. I wrote this book and I get the most talks to talk about the chapter on sexual health.
I bet.
Because nobody talks about it.
Yeah, and it's one of those things that I think just gets, if no one's there to talk about it and no one's there to suggest there is anything to do, people just say, well, I'm just going to shut that part down then.
Right, right. I just had a talk to the Her Self Health Women Over 65 on sexual health. And, first of all is, how many of you even ask the question of an 80-year-old if they're sexually active?
Right.
Have you asked that? No, because you already make an assumption. You assume that first of all, you don't care. And,
Yeah.
but you need to care, because that may be the one thing that's on that woman's mind.
Right.
So I think talking about just normalizing sexual health, identifying that vaginal dryness in aging women is a very common, undiagnosed condition that needs to be addressed at every annual exam and every with women, and it's not talked about because people don't even do a physical exam anymore. You go in for your wellness visit, and you're lucky if somebody listens a second to your heart. They're certainly not checking your vagina. So this can markedly be improved. Vaginal estrogen is very safe for women, and for women into their hundreds. And unbeknownst to a lot of people, a lot of women in their 60s, 70s, 80s, 90s, and 100s are using vaginal estrogen and continue to be sexually active.
Yeah.
Another common problem that happens is libido discrepancy between partners. One partner may have a lot of interest, and another partner may not have very much interest. And something I found in my practice was that often partners didn't talk to one another about their sexual health. That I would say, well, if I said to a woman, well, what does your husband think? Oh, I've never talked to him about sexual health.
Right.
Really?
Right.
This most intimate part of your relationship, and you're not talking about it? So even conversations with your partner is something that needs to be reinforced.
Yeah.
So those are just, but it's a big, big topic. And again, I'll go back to baby boomers were raised in a culture that sexual health was sinful. Only bad girls did that. There's a lot of
just for procreation.
Yep, just for procreation. You don't do that if you're, till you're married. So a lot of messages around sexual health that women continue to carry with them.
Yeah, and I imagine in terms of helping people get, if they haven't been sexually active, to get more sexually active, is also to consider what movement does for your body. And also because there's a lot of pelvic floor issues, and you talk about that in the book as well, that the incontinence issues might be another reason why people also aren't having sex.
You're absolutely right. And one thing I mentioned in the book is different yoga positions, and certainly Kundalini yoga is something that can be energizing to the pelvic floor and to the genital area. So it's not just about medication. There's a lot of other things that you can do, and yoga is a real strengthener in pelvic floor. Finding a pelvic floor therapist to work with you can be really important, because that is a condition. Urinary incontinence is, along with vaginal dryness, are two really problematic areas that need attention.
Yeah, and there are identifiers early on. I think people think. I did a podcast series already, or a podcast conversation already about pelvic floor health.
Oh, good.
And so people can look back at that if they want to. As a woman that I used to work with who does a lot of pelvic floor type PT work, but also that that pelvic floor is the base for a lot of things as far as strength is concerned. And so like even a lot of spinal conditions and stuff, and a lot of even organ health are going to be affected by that. So and it can start sometimes, as early as for women, as early as their 30s. And sometimes, I've even seen it with people who I say maybe overexercise a little bit, like marathon runners and stuff, who end up starting to have a lot of pelvic floor problems. And part of it is because of the tension that builds up. There has to be a tone. It can't be too tight. It can't be too loose.
Yeah.
And so trying to work on that. But that there's pelvic floor therapists are starting to become a lot more common. And so, if you do have a good women's health, support person, you should just ask if these are any of the problems that you're having. And traditionally I see it more, and I hear about it more in my practice, kind of around the 50s for women, but it can happen earlier.
It can happen earlier, certainly even after childbirth for a number of women. It can become
Exactly.
a
Yeah.
huge problem. And and then as estrogens decrease, it can even become more apparent for some women as they lose that tissue um, elasticity without the
Yeah.
estrogen.
Yeah.
So, yeah.
And the one other thing that I think would be good to talk about too briefly is the kind of idea of, with weight management obviously becomes sort of a challenge for people, but I also feel like it's very closely tied to sort of fatigue and recovery and sleep, right? They all sort of tend to line up. And so, it's one of the things I'm always coaching people on, and I do work with athletes quite a bit too, but this, as we age, the one thing that starts to slow down is our recovery processes. We can sometimes be just as fit, just as strong, do all these, our stamina can be really great, but the recovery side of it tends to be one of the biggest challenges. So, and I'm curious to know what your experience is with that, and how you work with trying to, because really what we're trying to do is also bolster the system and make it more resilient to all sorts of other things. It's not just about, exercise, but about just basic energy stuff, how your body is regenerating and healing.
Yeah. Yeah, I think that where we come back to, it really doesn't matter where you start, because wherever you start is going to interconnect with the next thing that you do. So
Yeah.
if we're
Yeah.
talking about weight concerns that a lot of women have, no matter what their age is, men too, is, everybody's looking for the perfect diet. I don't know that there's a perfect diet. I do know that there are some significant things that can make a difference, and that is, we as women take in far too many carbohydrates and not enough protein. And
Yeah.
if we want our diet, and so then that switches us over to the nutrition side. Well, what are we eating? And how is our digestion working? Because that
Yeah.
affects your gut brain, it affects your gut liver, and how we metabolize. If we reduce our carbohydrates, we're going to reduce our risk of blood sugar irregularities.
Yeah.
So, it just all is interwoven. And I know in my chapter on weight, I think that people, now, maybe I've been criticized for emphasizing too much about carbohydrates, but my point about carbohydrates is that, and I think this is for the typical diet. It's not for a vegetarian. Okay, I think that I have some exclusionary issues with that, but for the typical aging postmenopausal women, if they don't know how many carbohydrates they're taking in a day, or they don't even know what a carbohydrate is,
Right.
begin to, we got to look at that. Because if we don't
Yeah.
even begin there, how are we going to regulate your metabolism and your blood sugars?
Yeah.
It's not going to work.
Yeah,
So
and fiber, which you talk about in the book too. And I tried. I worked briefly in nutritional counseling, so I know enough about the base, and I've had enough people on the podcast talking about this stuff. But fiber, just fiber in food too. So especially in fruits and vegetables and seeds and stuff. They basically help slow the rate of sugar into your system, which helps with insulin response and helps you regulate that way too. And if you don't do that, then you're going to have to start taking supplemental fiber. So
exactly. So yes, get as much, and I think I say this in the book, get as much as you can from the diet. At the same time, there are certain supplements that we simply aren't getting that you need. And, we need to be taking vitamin D. Women need vitamin D. And you probably need omega-3 fatty acids because our bodies do not do that on their own.
Yeah. Which are, I'm curious, which things do you know that sort of dip as we age as far as what our body naturally produces that you always kind of recommend supplementally? Omega-3s.
Omega-3s, and the other day somebody said, "Oh, I get a lot of omega-3s. I do, I do a lot of different kinds of oils, or I do olive oil." I said, "That's not omega-3." Yeah. Oh, she said, "That's not omega-3. No, that's an omega-9." Oh, I didn't know that. So
right.
Just little things like that. Where I'm not saying that it's not a good oil to be using. I use it a lot, but it's not an omega-3. Anyway, omega-3, I think a little bit of zinc. I don't know that we always metabolize that so well. Maybe your Bs, your B12 especially with our gut, and maybe we're not, your intrinsic factor isn't working quite as well. And then a little bit of calcium, but not too much calcium.
Uh-huh.
So those, and of course D, those would probably be my essentials.
Yeah, and you mentioned magnesium in the book, and kind of break down magnesium. But can you remind me of there's like three or four different types is there a place to start or considerations for which kind of magnesium?
Yeah, I think that if you're dealing with constipation, then the regular magnesium oxide, that's going to work. If you're dealing with fatigue, then you really want to go with a magnesium glycinate. And so you have to, glycinate or glycinate.
Yep.
So it, which isn't as easy to find. So you might have to go, and you might not find that at the in the Target pharmacy.
Yeah, and malate is for which?
And malate is also, we use magnesium malate a lot around chronic fatigue, and
that's what I thought.
Fibromyalgia again, rather not using it like milk of magnesia, where we're using it as a stimulant or it's not a fiber, but as a way to improve. To improve constipation. So, I mean, magnesium varies, and not all people need it. You need to know the reason that you would be taking it.
Yeah.
The other thing that, I don't know that. Go ahead.
No, I was waiting for you. Sorry.
Yeah, the other thing that I think we're going to be seeing more and more of, and I'm not the one to speak to it, but I think you might have had a podcast, is around the use of cannabis.
Okay, yes.
Because I think cannabis is going to be seen more and more as just a common herb that we use for a lot of different conditions, especially around sleep and anxiety.
Yeah.
And sleep and anxiety are two real common problems that women have as they age. So I think we're going to be seeing the more use of that, whether that's CBD or THC. But I think being informed around that arena is going to be valuable in the future.
Yeah, and just like anything, it may be one of those things that we, there's different ratios of THC, CBD, and depending on where a person's at in a given moment. I mean, say somebody who has just, lost a parent or something and is really struggling to sleep might need something a little bit heavier and on the front side of it, and then that might be something that tapers, or they switch over to maybe, magnesium and selenium, and
Exactly.
it's something that's useful that really doesn't have side effects, and I think that's where a lot of the herbal medicines and supplements, the more we know about them, and I just appreciate someone organizing this in a book, and I know how much books take to put together, so just my gratitude to you for putting that together, and for giving this resource to people, and organizing it in this way. But I think it just goes to show, like, I haven't seen a book organized as well as this around this subject. And I feel like this is, we're still scratching the surface on how to think about, improving wellness for lots of different, groups of people that they're sort of falling through the cracks in the system.
No, I think you're absolutely right. There are many people for multiple reasons that are falling through the cracks. Social, economic reasons, racial reasons, transgender reasons. I mean, they're falling through the cracks. But my experience with postmenopausal women was it's a big array of a section of a population, but needs to be addressed. I do want to point out something for your listeners that might be helpful too. My co-author, Catherine Marino, who's a PhD at DePaul University in Chicago, has started a podcast, and it's called...
Oh, great.
Yes, it's called Women Over 70. And if you just Googled Women Over 70 podcast,
I'll throw a link up for it too.
Yes, and she has interviewed over 300 women from the ages of 70 to 105. Talking about their life stories and how they found purpose, and it is diverse. The stories you hear are amazing about these highly motivated, engaged women purposefully doing new adventures as they age.
Yeah.
And
sounds great.
Yeah, and it's from all aspects of healing. And I know we can't forget in the aging population the whole spiritual aspect of health and healing.
Yeah. And interconnectedness, our daily connections, our sort of broader connections.
Yes. Yeah.
That's
so
really
I hope
cool.
This is valuable, Jeremy.
Yes, this is so great. Thank you so much for taking the time to do this. And where is the best place for people to find your book?
They can go to Amazon. They can go,
Okay.
it's Taylor and Francis Press, so they can see it, go there, but probably going to Amazon is the best place to go.
Okay, sounds good. And I'll put a link for the book up. We have show notes for the podcast, so I'll put that and the link for this other podcast too, so that people can easily find more resource.
Yeah.
But I really appreciate it. It's so fun to finally get to chat a little bit longer with you about things.
Absolutely. And if you want somebody to talk more about specifics about hormonal therapy, or do you ever have a Q&As? Or has that been a part of
it's a great idea, actually. I should do it, do something live so that people can ask questions too.
Yeah. I mean, that's always an interesting way around sexual health, around anxiety, really around any of the chapters in my book, to have Q&As where you really have real life clinical situations that come up, and we look at integrative approaches.
That sounds great. Well, thank you so much. I really appreciate it, Carolyn.
Absolutely. My pleasure. Thank you so much.